Today we'll go over the #1 tip that I learned about root canals that specifically relates to how to avoid breaking files, but it's also helpful to getting your tricky turns and tight canals navigated. This is a tip that I would have paid a lot of money for to have known right out of dental school because it's the opposite of what I was doing. And so the part of the root canal that we're talking about is after your orifices are found, right? So we've accessed the tooth, we've found the orifices, and now we're going from our first hand file to our finishing files before we obturate, right? And so from the first time we start using a file to the last time we use our rotary file, there is a very distinct thing that you should be doing that'll prevent you from doing ledges, perforating, migrating the canal, and of course breaking your files, right? Obviously, files break. So you're always gonna have files break. If you do 1,000 root canals, one file at least will break. But this will drastically reduce the amount of files that you have breaking. And so it all comes down to how we actually use the files. So I said this was the opposite of how I was taught and how I learned. I wasn't taught it this way, it's just how I did it. Instinctively, you think that you're cutting the canal when you push, but this is not the case. It's the opposite. And so if I grab my absolute replica that WaveOne made and sent to me, pretend this is your file, right? If this is my file and has all of these notches on it, if I just rub this back and forth on a tooth, it will slowly start to eat the tooth away, right? It's not gonna saw the tooth in half, but if you grab an extracted tooth and you rub the file on it for 30 seconds, you'll see some dust there. So you are removing tooth structure. And this is all we want with a root canal. We aren't cutting a crown prep. We aren't drilling through the tooth. We're just very lightly scraping away enough so that the next file can fit in. And all of this scraping movement should be done on a pulling force. So when I have my file, when I'm putting it in, all I'm trying to do is lightly wiggle it, maneuver it into the right hole. It's like threading a needle, right? You wouldn't, if you were trying to thread a piece of thread through the hole of a needle, you wouldn't try to push harder, right? When you push harder doing a root canal and it works, it's not actually working, it's just moving the canal. When you're putting thread through the hole of a needle, you want to be very careful. And if it didn't go in all the way, you would just turn it a little bit and then lightly try to push it again. Because you want it to be very light, because eventually it's just going to be moving, and then tuck into the tiny little spot that it fits. And then when you lightly push, it's able to continue there. So when we have our instruments, and I'm demonstrating right now with like a hand file, but I'll show how it works for both. If this is my hand file and these are my nicely illustrated cutting edges, I'm just lightly wiggling it in, and then I'm pulling up to have this scrape the edge of the canal. So I'm wiggling it in very gently, and then as soon as it gets kind of stuck, then I pull it out, right? It's the same thing of the balanced force technique, where you do a quarter of a rotation forward to engage it, and then you untwist and pull, right? What you're doing is you're doing a light twist to engage it in, and then you pull up, right? And this makes sense for hand files. It's something that we learned for hand files, but it's the same for rotary instruments. But before I get to rotary instruments, I'll pull up this video here to help you understand when to go to rotary instruments. Because if you go too soon, it doesn't matter what technique you're using, you're not gonna get the nai-tai rotary file down to length. So at my office, how I do it and how my associates do it is we will get a clear flow path with the 10 file, and then we'll immediately switch to rotary instruments. So we don't work up to the 25 file like we did in dental school. We use a rotary instrument that is the same size as a 10 file. But the important thing here is that we have a clear flow path. What that means is that if I get my 10 file, all I need to do is put it in the orifice and push, and it will go all the way to length. So if you look at this video here, the file's going down, and if it gets stuck here and isn't just going all the way through, then we do what we just said, where you give it a little bit a twist, you twist it in there, you wind it in there, and then just pull back up. We don't switch until we can just push up and down like this. Up and down, and it goes all the way to working length or to patency, right? If I need to wiggle it down at the bottom, my canal isn't actually the size of the 10 file. If we get my beautiful replica model again, if my canal is the same size as my file with all of the flutes, I will be able to just push it through and it'll go to length. If I get to the bottom of my canal and I have to twist it to length, that means I'm cutting grooves into the tooth to get to length. And so if you can pull it straight out from there and then it clears enough that your rotary files will get to length, you'll be okay. But if you have to wiggle your hand file before going to a rotary instrument, then you're not ready for the rotary instrument and it won't go down. And then once you're using the rotary instruments in there, it's the same feeling as the hand file, where with the hand file, I'm wiggling it in until it's tight enough that I don't think I'm gonna be able to pull it out if I get it any tighter, right? So a little bit in, then pull. Obviously, this depends on how calcified your canal is. Most people's teeth, you don't even need a hand file. You can just start right with the rotary. But if you can't get your clear flow path with your 10 file, then obviously you need to get there somehow. So a little bit in and then pull. And then when you're using the rotary instruments, it's the same thing, where we want a tiny bit of engagement. And as soon as we get that engagement, we want to pull up. So even with the rotary file, we are trying to cut in the pulling direction. And how this is done is by feel. So you're going in there with your drill, and as soon as you feel it about to bind, you're pulling up. As soon as you feel it start to bind, you're pulling the handpiece up to pull the file out. And technically, you're pulling it up and away from the furcation so that you cut the lateral sides of the wall so that you're less likely to perforate. But that's not as important. What's important is that you're not pushing down to cut. You're pushing down just until it engages, and then you're pulling up. And patience is key here. Irrigation is key. Just having milk too concentrated irrigant can cause your file to bind. So if you're in a tight space, especially with your rotary instruments, and you've gone in a couple of times, it's tight, you've gone in maybe 5 times and you've only gone down 1 millimeter or 0.5 millimeter, take it out, clean it off, and irrigate, rinse it out. And that alone, always pulling, only cutting on the pull, knowing when to start using your rotary instruments, and having your irrigation channels clean and not over concentrated will change the game for your root canals, make them easier to clean and shape, and will drastically reduce the amount of times you break files.